So across Canada, emergency departments are experiencing some of the longest wait times we have ever seen. Last year alone, Canadians made more than 16 million ER visits. And for patients who needed admission, many waited over 24 hours in the ER before they got a hospital bed.
And to help us understand when to head to the ER and when other care might be better, we're joined by the doctors behind the Doc Talk podcast, emergency physician Dr. Shazma Mithani and family physician Dr. Sheila Wijayasinghe. Welcome back to the Social Ladies. Love the matching outfits.
Love.
All right, so Dr. Mithani, as you can hear from the audience, I think a lot of Canadians have experienced long wait times in ER. So tell us, nationally, what's the situation like? Is it getting better or worse?
There are very long wait times around the country, and unfortunately, because of the viral season that we're starting to come upon now with influenza and COVID, those wait times are just getting longer. And so we're seeing sometimes in excess of 8 to 12 hours for wait times. Okay. Yeah, and I mean, of course, if you have a severe medical condition, which we're going to talk about today, you'll get in faster, but we are still seeing pretty long wait times right now, unfortunately.
Yeah. Okay, so you just mentioned it. I mean, there are very obvious emergencies I think a lot of us can think of, but other times it's not always clear exactly when we should or should not go to the ER or wait to see our family doctor instead, which could be also a wait. So what is the rule of thumb, Dr. Sheila, to go or not go?
Yeah, so it's tricky sometimes to know if you should or not, especially with the wait times for family doctors as well. But the rule of thumb that I suggest to my patients is if waiting is a risk to your health. So if you wait longer to see a doctor, is it going to be harmful to you and cause potentially irreversible harm? And so those things are kind of obvious sometimes, but not always. But the things that we suggest are things like chest pain, abdominal pain that's very severe, heavy bleeding, severe infection. Those kinds of things should go to the emergency room so you can get those investigations on the same day and get treatment. The things that we do really well in primary care are things like bladder infections, mild infections, rashes, medication refills. Those are the things that should not be going to the emergency room. That's very well managed by us.
Got it.
All right, so Dr. Mithani, there are also long wait lines for diagnostic testing, and I understand that some people try to go to the ER to fast track that. Is that what the ER is for, and is that a good idea?
No. So like the answer to both is no. I absolutely understand how it's challenging to have to wait long for your diagnostic tests that your family doctor orders, but the ER is actually quite limited in terms of what we can offer for things like imaging or blood work. And we're often restricted in what we can order those things for. And so trying to come to the ER just to get that test faster is not going to be the most effective use of care or effective use of resources.
Okay, that's hard, but we understand. It's true.
Yes, exactly.
Okay, since COVID and beyond and since, virtual care is something that has been really normalized. It's really accessible and widespread now. So when is telemedicine a better option than maybe going to see somebody in person?
Yeah, this is a silver lining of the pandemic, is that there's just so much that we can do virtually. So mental health checks, med refills, sort of mild things can be managed very well virtually, but I still need to see you, Shaz still needs to see you if you're having some of those more serious things like chest pain, abdominal pain. We need to actually be able to do an examination and investigate you. So virtual care is excellent. It's an excellent triage tool to help us understand if you need to be seen or not, but it's not for everything.
All right, good to know. All right, so Dr. Mithani, you're also a pediatric emergency doctor, and I know parents want to do everything to take care of their children and protect them. So how should they decide when to take their kids to the ER?
So this is something I see a lot with worried parents coming in, and this is kind of part of the discharge instructions that I give them when to come back. So any child under the age of 3 months old or that is immunocompromised in any way that has a fever absolutely needs to come in. If there are breathing issues that are getting worse or you're worried about, absolutely need to come in as well. Any signs of severe dehydration or your child is not taking enough fluids in, is vomiting so much they can't keep fluids down, absolutely another reason to come in as well. And then, I always say, if something doesn't feel right for you as a parent, so if your child is sleepier than usual, more irritable, like they're crying and you can't console them, or something in your spidey senses just isn't quite there, please come in and see us.
All right, good advice. All right, so Dr. Sheila, how does preventative medicine play a role in these long wait ER times?
It's so important. This is the role of a family doctor and why it's important to really safeguard our public health care system. Over 6 million Canadians do not have a family doctor. And we know that if you have a family doctor, you have a lower incidence of going into the emergency room because we're doing that preventative care. So we're checking your blood pressure before it gets really high and causes a heart attack or a stroke. We're doing the cancer screening before you end up seeing Shaz for an end-stage cancer in the emergency room. So there's so much that we can do as family doctors, nurse practitioners, and we really need to do that in primary care and safeguard that for our whole healthcare system.
Yes, God save the family doctors.
So true.
Okay. Dr. Sheila and Dr. Shazma, before you go, we are going to go through some different medical scenarios. We all have paddles, which say ER or no ER, and we're going to try to guess if the scenario warrants a trip to the ER or not. Okay, so here we all get it, right? We get it.
Ready?
First scenario, you have a persistent headache lasting for 3 days.
Oh, ER not.
Oh,
I don't know.
Okay, I don't know. I don't know.
ER.
The docs say ER.
Really? Okay, why?
With some caveats, but for me as an ER doctor, I'm not going to be fussed about seeing someone that has a severe headache for that many days, because even if it's a migraine, I want to be able to offer IV medications to help improve that pain. We worry about things that are more serious potentially, like a severe infection, a bleed in the brain, or like a tumor, things like that, especially if it's not a headache that you've had before. We want to see you for that.
Okay, good to know. All right, so here's our next scenario. You have a severe allergic reaction that was improved after using an EpiPen. Should you head to the ER or no ER? What do you guys think? No ER? Yeah, no, I'm saying
Ooh,
ER.
this is mixed.
Yeah.
ER.
ER.
Yeah.
All right.
And so the reason behind that is certainly it's great that you're feeling better after you've had the EpiPen given. However, you can actually, as it wears off, you can have another reaction, and we need to monitor you. So a severe allergic reaction needs to go to the emerge, even if you're responding.
Okay, good to know.
Good to know. Okay, next scenario. I'm 1 for 2 here.
No, me too.
Okay, you're experiencing dizziness when you turn your head.
Okay, wait. This is a trick.
I don't know.
Dizziness when you turn your head.
know.
No. I feel like this is
I don't know.
911.
No ER. Okay, what's going on?
So with dizziness when you turn your head, typically it's from benign vertigo, so because the stones in your inner ear are what's off, but with some caveats as well. So if it's like brand new dizziness, you have risk factors for stroke like high blood pressure, high cholesterol if you've had a stroke before. If you're so off balance when you're walking, like things like that we would call red flags, that should come to the ER.
Oh, okay.
But more basic vertigo, just when you're turning your head, definitely can be seen by someone like Dr.
Go
Sheila.
to your doctor. Okay, got it. Last scenario, you're 1 month old, is experiencing a fever.
Goes without saying.
They were up with the one, okay.
I'm not even a parent to know the answer to this question.
I don't know, right?
ER, right?
Yeah.
Yeah.
ER, okay.
So you were listening before to what Shaz was saying. So any baby under the age of 3 months does need to get checked out because we worry about sepsis. So very severe infection needs to see the ER directly beyond the family doctor.
All right, well, Dr. Mithani, Dr. Sheila, thank you guys so much for being here and giving us very important information.